The state process that was approved by the federal court required the Department of Human Services, which does Tenncare eligibility for the Tenncare Bureau, to do what's known as an ex parte review, which means they look through their own records and the records available to them electronically from Social Security without talking to the beneficiaries themselves to see whether they could find the person eligible based on what was already in their files. They found about 9,200 people eligible. That leaves 140,000 plus who are going to have to go through a process now of responding to the peach-colored RFI forms and providing the information to show that they are eligible. To let you know just how tough that process is going to be, the Department of Human Services announced last week that they expected that a total of only 10 to 11,000 people would end up still being eligible. They've already found 9,200 of those people eligible, so they're projecting that as few as 800 to 1,800 people out of that 140,000 will be able to run the gauntlet and still hold on to their benefits. The thing that's particularly concerning about that is a year and a half ago, the state was telling the court that they anticipated that most of the people were in fact otherwise eligible. So I think what we're dealing with is a situation not where people are ineligible, but where they simply can't run the gauntlet to show that they're eligible. And they will have the burden. So the point of this is twofold. We're dealing with a very vulnerable population, and they need all the help they can get one-on-one to get through this process, where good advocacy will make the difference between them retaining their health coverage or not. The other larger point is that even one client at a time, one patient at a time, one beneficiary at a time, the attrition is going to be very, very high. And this comes at a terrible time in terms of strains already on the healthcare infrastructure of the state. Pulling out this money couldn't happen at a worse time in terms of the healthcare economy, and of course it's really the equivalent of kicking these families when they're down. And so this is an occasion that calls not only for one-on-one advocacy, but advocacy at the policy level to say to state officials, this is really not a good plan. We didn't think it was a good idea for 20 years. If it wasn't a good idea for the past 20 years, good times bad, it certainly isn't a good idea right now. These people will not be able to find other coverage, and they'll be really left at sea. Fortunately, the Obama administration stimulus package that was adopted in February, known as the American Recovery and Reinvestment Act, or ARRA for short, ARRA, has a provision that says that if states accept Medicaid stimulus money, which was put out by Congress to stimulate the economy and try to retain jobs in the healthcare sector during these difficult times, as a condition of accepting that money, it has to agree to maintain eligibility just as it was in July of 2008. Well, in July of 2008, all 150,000 of the Daniels people were protected by a court order, and they were protected by the terms of the Tenncare waiver, which is the agreement with the federal government. So it is our position that the acceptance of that money, and the state has already accepted over $300 million in the Medicaid money, bars the state from going forward with these terminations. The state administration looks at it differently. The Tenncare Bureau says, no, we can go forward, and they're intending to do so. They're going to send out the first notices by the Department of Human Services May 1st. But it's not too late to communicate to our congressional delegation and indeed to the White House itself that this is not the way the money was to be sent. We don't need a situation where taxpayer dollars are going out to maintain eligibility, to keep funding up for the healthcare infrastructure, and then that's ignored. So we're facing enormous challenges, not only for the Daniels people themselves, but for the ripple effect that it will have in communities across the state. There are particularly lower income communities are still reeling from what happened 4 years ago when the Tenncare cuts occurred. There are major healthcare providers that are still reeling from that. we cannot afford another blow like that.